Chapter 2 deals with pathogenic fungi. Medical mycology. Mycology is a specific area of studying fungi. So medical mycology is where you are going to be studying different fungal pathogens. How do you diagnose these fungal diseases? How do you manage them? How would you prevent them? They are some of the hardest diseases to try to diagnose and then also to treat. The signs and symptoms are often very vague, and so they can be misdiagnosed as something else. And then in terms of treatment, because fungi are also eukaryotic cells, just like your cells, it can be very difficult to treat. Fungi produce spores, and they are just about everywhere in the environment. Most people have a fungal infection at some point in time. How do you get the infection? Typically, you will inhale the spore, you may ingest the spore, or there may be some type of trauma that allows the spore to penetrate into the body. Very rarely is it going to be transmitted person to person by direct contact. So most of them are not contagious. Oftentimes, they're not even going to be reported like to the CDC. There's only 4 fungi that are considered as true pathogens. All the others are considered as opportunistic. There are certain factors that can increase a person's risk for developing an opportunistic infection by these fungi. That would be if you have any type of an invasive medical procedure done, any type of medical therapy, certain disease conditions, and certain lifestyle factors. The true fungal pathogens are endemic usually in the Americas. The opportunistic ones are going to be everywhere. So this table just shows what some of those risk factors are that can predispose an individual to picking up a fungal infection caused by one of those opportunistic fungi. There's 3 categories of how the disease is viewed or classified, whether it is a fungal infection. This is going to be the most common type thing. It can be caused by either the true pathogen or the opportunistic ones. The fungal toxicosis, which is basically you acquire it by ingestion, and it is where the fungus is producing a toxin or a poison, and it's actually the toxin or the poison that's making you sick. And then the third type is allergies, and that's usually when you inhale the spores. In terms of diagnosing a fungal infection, sometimes this is difficult. You really need to talk to the patient and get their history, kind of read between the lines as to where have they been, what might they have been exposed to. You then are going to have to be able to observe the fungus and look for different characteristics for each species with it. Usually fungi will grow on saboroid dextrose agar. This has a little bit lower pH. Remember, fungi prefer a lower pH than bacteria. So because the pH is below 7, it favors the growth of fungi. You can, depending on what you suspect with the patient, you can get samples. There's other techniques that you can use, whether it's fluorescent antibody. It depends on the specific situation as to how you're going to diagnose. As you can see in the stain, you can do fungal stains, you can do the fluorescent staining as in terms of treatment or therapies. Mycoses or fungal infections are really hard to treat. And one of the main reasons for this is because, once again, fungi are eukaryotic cells. So from a biological, physiological standpoint, they're very similar to your cells. So how do you kill it without causing damage to your own cells? And that's one of the problems that we have, is that some of the antifungal drugs that we have may be effective in killing the fungi, but over long-term use, they can also cause damage to your cells. So it's really a balancing act that we have to do to try to find something that's non-toxic to your cells, but will. And there's various drugs that have been somewhat effective. Usually what we find is, say, with opportunistic infections, you have to do what's known as a two-step. You need to first give a high dose of the medication to try to reduce the number of those pathogens, and then you give a low dose for maintenance therapy. So typically it is going to be a much longer treatment plan than what you would see for treating bacterial infections. Antifungal vaccines, yes, have been very difficult to develop, once again, because the metabolism is very similar to ours. Vaccines are very expensive to make. And another reason why there are very few antifungal vaccines is that for healthy individuals, fungal infections usually will not be severe. And this is the case of where yes, money talks, because it takes a lot of time to develop a vaccine. It takes a lot of money to develop a vaccine. It's going to come down to, are you wanting to spend this time and money developing a vaccine for infections that really are, for most people, will not be that severe? As we go through some of these, you'll find that a lot of these, you basically let it run its course. And for healthy individuals, may actually be asymptomatic. They never even know they have it. So no, your pharmaceutical companies, the research labs are not typically going to put as much effort and time into developing antifungal vaccines. There are a few, as you see listed here, that there are some vaccines for, but not very many. Systemic mycoses, or systemic fungal infections caused by these pathogenic fungi. Systemic means it's spreading throughout the entire body. There's four main pathogenic fungi that will cause systemic mycosis, and all these are in the Aspergillosis, Histoplasmosis, Coccidioides, and Paracoccidioides. Most of these are caused by the inhalation of the spores. And so because it's inhaled, at first it has the appearance of just a respiratory type infection. And then it can spread via the blood down through the rest of the body. All four of these fungi are what we call dimorphic, meaning they can grow in the body in two different forms. One is as mycelium, the other is as yeast. Yeast tends to be the invasive forms. So that causes a problem in itself. As you can see here in the upper portion, where in the environment it's often as in that hyphal form, mycelium form. Hyphae is the individual strand. You have a group of them. Hyphae, remember, that's the mycelium. And then they form the spores, which become invasive and then infect the humans. And in humans, then they will grow in that yeast form. Histoplasma capsulatum is the causative agent for histoplasmosis. This is one of your more common fungal pathogens. It's found throughout the eastern United States. It's found in Africa and South America. It tends to be found in very moist soils, especially if it has a very high nitrogen level to it. Usually what happens is the individual inhales the spores. This map shows the endemic areas for histoplasmosis. For most healthy individuals, it's going to be asymptomatic and basically run its course and you'll be fine. There are a couple of diseases that can be caused, mainly in individuals who are somewhat immunocompromised. There are some drugs that can be used to treat if the infection is more. And this is what the spores look like. Blastomycosis, Blastomyces dermatitis is a causative agent for blastomycosis. This is endemic in southeastern United States in quite a large range, all the way up to Canada. It is found also in soil. You'll find out that a lot of the fungi are typically found in soil because they are often involved with the breakdown of decaying material. That they're often found in very rich soils. And it can cause initially respiratory type of symptoms because typically the spores are going to be inhaled. A lot of healthy individuals would remain asymptomatic. So you can see here a wide range in which it is found. Sometimes blastomycosis, if we have what we call cutaneous, you end up with lesions on the face or the upper body. If it's osteoarticular blastomycosis, this is where, as the name implies, the fungus tends to spread and infect some of the bones, especially around joints. In someone who is immunocompromised, it can also spread to the central nervous system and cause a form of meningitis. This is seen especially in AIDS patients whose immune system has been compromised. Once again, you can treat it with certain antibiotics. This shows cutaneous blastomycosis on an individual. Coccidioides is a causative agent of Coccidioidomycosis. This is found in northern Mexico and southwestern United States. This is one that's a little bit different because this tends to be in the desert, much drier environment than what you would typically find fungi, or where you would think you'd find fungi, because they usually like moist environments. Infection rates have been rising in some of these areas, and why is that? Because you have increased population in these areas. You have increased exposure, expansion out into areas for either growth of communities or recreational activities, and so you encroach on an area where it exists naturally, you're going to start seeing increased infection rates. So once again, here's the map showing the endemic areas. You tend to have these little spheres with spores inside. Coccidioidomycosis usually has respiratory issues or infections. Patients, if they're healthy, may not show any symptoms or just very few symptoms. Some individuals, if they're immunocompromised, may develop a more severe infection. In that case, antibiotics can be used. This is showing one of the lesions that's formed in the subcutaneous tissue. Paracoccidioidomycosis. Brasiliensis is the causative agent for Paracoccidioidomycosis. This is found in southern Mexico and parts of South America. Typically, the type of people we see who become infected, it would be farm workers. The fungus, you have the spores that's often found in the soil area, and so is this inhalation that. Now this has a very characteristic, what we call a steering wheel formation when the yeast is present, and so diagnosis can be done by that, and then there are antibiotics once again that can be treated. So this is the classic steering wheel that you see. Remember that even though we're saying there are antibiotics, a lot of these antibiotics are fairly strong. Unfortunately, for fungal infections, typically you must take the antibiotic for a longer time period than you would, say, for a bacterial infection in order to treat the infection completely. You need to be careful of this though because they tend to be stronger. You need to be vigilant and watching for side effects, adverse side effects on your patient. Opportunistic mycosis usually don't affect healthy individuals. Usually you have to be immunocompromised in some fashion in order to get these. Unfortunately, what we see is a lot of AIDS patients developing these systematic mycoses by opportunistic fungi because their immune system is compromised. That's what this virus does, is it compromises and basically wipes out the immune system, thereby making them more susceptible to all of these other secondary type of infections. For a healthy individual who's not showing any symptoms, they're asymptomatic, it's very hard to treat them because they don't know they're sick. Pneumocystis Jirovecii used to be known as Pneumocystis Pneumonia, causes a type of pneumonia. Most people are exposed to this as a child. Transmission is usually through inhalation, and in a healthy individual, it's not going to cause any problems. Like I say, you're going to be asymptomatic. The problem is, once again, in your immunocompromised patients, specifically your AIDS patients. This happened to be one of the telling things that helped us to realize in the identification of the HIV virus and having it associated with AIDS patients as a causative agent, is that we're noticing a lot of secondary infections. A lot of these patients were developing pneumonia caused by Pneumocystis Carinii, or which is now renamed the Pneumocystis Jirovecii. It was unusual to see the sudden increase in number of cases of pneumonia caused by this fungus. And that was what kind of raised a red flag of, wait a minute, what is going on here? Like I said, this is very common to see in the AIDS patients. You can treat it with various antibiotics. This shows what the cyst looks like in a sample of lung tissue. Candidiasis is caused by Candida albicans. It's fairly common on the skin and mucous membranes. This can be transmitted from individual to individual by contact. Most of the cases are going to be opportunistic. It can cause a wide range of various diseases depending on where the infection is occurring. It becomes systemic, usually only in your immunocompromised patients again. So this table is showing you, once again, depending on where the infection occurs, determines which type of disease you would end up with. And once again, here's a table showing the various types of signs and symptoms and disease that's caused. Once again, slide of what it looks like. You would look for identification or diagnosis for those yeast and the little small, we refer to as pseudohyphae. Treatment depends on the particular disease, and somebody who is got a good immune system, you might want to treat underlying problems first. It once again depends on where the infection is as to what type of antibiotic you're going to give. Aspergillosis is the causative agent of aspergillosis. There are several different diseases that can cause aspergillosis. Is very common in the soil. So oftentimes the way a person contracts it is by inhaling the fungal spores. Oftentimes it may just cause type symptoms. This shows some of the different types of reactions that you can get, whether it's asthma, whether it's allergic reaction, or something more serious such as pneumonia. And this is showing a lesion near the eye from an aspergillus. If it's hypersensitivity, you treat with allergy medications. If it's more invasive, then you can remove the lesion and treat also with certain methods. Cryptococcosis. There's two different types or varieties of this. Uh, One that can infect healthy individuals. The other one will infect AIDS patients. We see a lot, uh, once again, because they're immunocompromised. And you inhale spores. Oftentimes, this is associated with the fungus has infected birds, and the spores are in the bird droppings. So, for this reason, it's usually recommended that if you are, for whatever reason, cleaning an area that has a lot of bird droppings or cleaning out bird cages, possibly wear a mask just to help with prevent the inhalation of those spores. You can end up with, from Cryptococcosis, you can end up with a mild type of pneumonia. Healthy individual, you may be totally asymptomatic once again. There are different strains. If the fungus is able to get to the central nervous system, it can cause much more severe form of meningitis. It can form under the skin inflammation of the skin. Cryptococcus is going to look like this on a stain. How are you going to diagnose it? Identification of that fungus from the sample. Treat. Once again, there's various medications, but for fungal infections, it's going to be long-term. It's not 10 days. It's going to be a much longer-term treatment. There are some genera in the Zygomycota division that can cause infections. Typically, you see this in individuals who have some other type of lifestyle or health issues, such as diabetic who is not controlling their diabetes, people who may be using illegal drugs, cancer patients, or patients who are receiving other antimicrobial drugs, and so it has offset that normal balance of the microbiota. Usually the infection is going to develop in the face area, and then it can spread from there. This shows some of the different genera and types of zygomycoses that can occur, and the locations of them. Usually the diagnosis, once again, is by taking a sample and looking at it microscopically, and then removing the infected tissue and treating with antimicrobials. We are finding more and more opportunistic fungi infecting AIDS patients. And as I said earlier, and as you've noticed, several of the previous diseases seem to be more closely associated with AIDS patients. Once again, this has to do with the HIV virus basically knocks out the CD4 cells, which are the ones that are going to stimulate your cytotoxic T cells and your B cell production, which are producing the antibodies. It's essentially wiping out your immune system, and so it's going to make the individual much more susceptible to any type of infection. And that is definitely what we are seeing, is that AIDS patients are much more susceptible to these various fungal opportunistic species. So in a healthy individual, it's not a problem, but in these individuals whose immune system is compromised, we're seeing an increase, which is why we refer to it as emerging diseases. We're seeing an increase in this. You can only use so much as far as the antifungal drugs, because we don't have, as I mentioned at the very beginning of this chapter, we don't have a huge selection to choose from. And you typically, for fungi, have to give a longer treatment. And then that increases issues with potential adverse effects, side effects because the drug may start affecting your cells because they are also eukaryotic cells. Some of the emerging pathogens that we're starting to have problems with are things such as Fusarium species, Penicillium species. A lot of these, like I say, are opportunistic ones. They may not be life for some of the cutaneous and subcutaneous ones. Superficial mycoses. These are, as the name implies, infections right along the surface, the outer surface of the skin, the nails of the hair. What happens is the fungi is feeding on the dead cells. Remember what you're seeing as far as the hair and the nails, and, well, part of the nails in the skin is actually dead cell, and that's what the fungi feed. Some of these fungi, we refer to them as dermatophytes, can infect the skin, hair, or nails. It's what often used to be referred to as ringworm. It can trigger a type of cell-mediated immune response that then is going to cause additional damage to your tissues. It can be spread from person to person. An example of this is athlete's foot, as seen here. And this table lists some of the more common ones: the disease, what the causative agent is, what are the signs, what is the source of it. Usually you treat the infection with a topical antifungal agent like a cream. If it is a widespread infection, then you can give an oral antibiotic. Some types of fungal infections and other can cause depigmentation or like patches of scaly. This is what it looks like, where you have the pigmentation is lost in the skin. So you have those lighter patches. This also can be treated with medication. For the cutaneous and subcutaneous mycosis, these fungi are commonly found in the soil. There has to be some type of break in the skin to be able to get the fungal introduced or penetrate beneath the outer layer of the skin. So usually there's a cut, an abrasion. Oftentimes, for some of these, the people who are going to be more susceptible are those who may work in the soil where the spores are often found. So obviously that's going to put. And here's a list of some of the different cutaneous and subcutaneous mycoses. They often will produce a lesion just under the surface of the skin that can gradually get worse. And this shows along the skin here, the lesion just under, it starts just under the outer layer of skin and then progresses. You can look to distinguish some of these microscopically. How do the spores look? Is there hyphae present or not? What's the spores for identification purposes? There are mycotoxins. These will cause tumor-like infections. These fungi are also found in the soil, can be introduced into the body by a wound, cut, etc. Once again, individuals who work with the soil are going to be most at risk because that's where the spores are. If left untreated, it can spread and cause destruction of the bone itself, such as seen here. So you're going to want to remove surgically the lesion and then start with antimicrobial administration. Sporoarthritis is a causative agent for sporotrichosis. Once again, another fungus that's found in the soil. So people working with plant materials can be higher risk and can cause a subcutaneous infection, typically along the arms. Usually you get these little nodules formed. Then it can enter into the lymphatic system from the primary lesion, and then secondary lesions occur in the skin. You can kind of follow along where the lymphatic vessel is, where you then get these secondary lesions. Diagnosis: talk to the patient, get their history, look at the clinical signs, look at a sample under the microscope. Usually you can treat with a cream, a topical agent, prevent infection in the first place by protecting yourself wearing clothing. So here you can see the lesions progressing along the arm. Now, some fungi, it's not so much that the fungus itself has to invade to cause a disease, it's that it's producing a toxin or it triggers an allergic response. So there's different types of what we call toxicosis, where either you ingest the toxin itself or you eat like the fruiting bodies such as the mushroom, and by eating the fungus, you're ingesting the poison. So some fungi do produce toxins, just it's like a byproduct of their chemical reactions that they're carrying out, their metabolic activities, and they're producing these. It's of course not a toxin to the fungus, but when you consume something that it's on, such as a vegetable or a grain, then you tend to consume the toxin as well. The most common one is aflatoxins. This can cause liver damage. It's very prevalent in the tropics. So you must be careful and make sure that you're testing the grains and vegetables to make sure you're not ingesting any of these mycotoxins. In terms of mushrooms, most mushrooms are okay to eat. However, there are some that do produce very dangerous toxins and poisons that can range from causing hallucinations to death. It's not worth it. Usually when somebody has a mushroom type poisoning, it's from somebody who thought they knew what they were doing when they were picking wild mushrooms and eating them, but they really did not accurately know how to identify them. Several different species of mushrooms look very, very similar, where one is fine, but one is poisonous. The deadliest mushroom is known as the death cap mushroom. It can cause liver damage, and as the name implies, it can lead to. This is what it looks like, the Amanita mushroom. There are some other deadly mushrooms as well. That's not the only one. Some of these can cause kidney failure, liver failure, like I say, lead to death. Treatment: usually they're going to try to induce vomiting to get you to basically vomit up as much of the mushroom before it can be absorbed. And then they will also administer activated charcoal to try to absorb those toxins. Very severe cases, liver transplant may be needed. Several years ago, when I was living out in Oregon, there was a case of about 5 or 6 individuals, I believe it was 6 individuals that went out one weekend to pick mushrooms. One of them in the group thought they knew what they were doing, and they went back to one of the individuals' homes and cooked the mushrooms and ate them. They all ended up getting very, very sick and ended up in the hospital, and 5 of the 6 ended up having to have liver transplants because the individual who thought they knew what they were doing did not and picked the wrong type of mushroom. A lot of people have fungal allergies. It can be very kind of hard to pick out exactly which fungus it is you're allergic to. Usually the spores may be airborne, and that is what's causing your reaction, which typically is going to be something like asthma, hay fever, skin rash, the eczema. There's really no way to avoid this. It's going to happen.